Hello, my name is Dr. Bruce Eimer. I'm a clinical psychologist and pain management specialist practicing in Lake Worth, Florida in the United States. The title of this brief presentation is Clinical Applications of the Science of Pain Relief. Persistent pain can cause the central nervous system to become hypersensitive to pain and non-noxious signals from sensory receptors. A neuromatrix develops which keeps pain sensations going, and the central nervous system pain gate stays open. A formal definition of pain is that pain is an unpleasant bodily experience that feels like something in the body has been or is being damaged or destroyed, that it feels like a threat to or interference with one's ongoing functionality and health, and is associated with negative emotions such as anger, anxiety, or depression. Taking that definition as a foundation, a good definition of comfort, which would be construed as the opposite of pain, is that comfort is a pleasant bodily experience that feels like something in the body has been or is being healed, strengthened, repaired, or replenished. That is associated with positive emotions and that can enhance one's ongoing functionality and health. Let's briefly take a look at pain neurology. In the central nervous system, there are various specialized nerve fibers that transmit sensory signals up the dorsal horn of the spinal cord to the thalamus in the midbrain, where the signals are interpreted. C fibers transmit heat or cold, mechanical, and chemical sensations. A fibers transmit nerve signals very quickly and basically are responsible for transducing sharp, well-localized pain that one feels right after an injury or tissue damage has occurred. Special A fibers transmit sensations of pressure, touch, and vibration, as well as rubbing. And other A fibers send nerve messages from the brain down the spinal cord to activate peripheral nerves, which in turn activate muscle fibers. These messages can cause muscle spasms or turn them off. So essentially what we're talking about is a pain gate that can open or close the spinal cord highway to the transmission of pain sensations and their registration in the brain. That there are C fibers, which actually are very, very small, very narrow, and transmit sensations of pain, cold, mechanical, and chemical sensations more slowly than the larger A fibers, which either transmit acute or well-localized pain, or special A fibers that transmit sensations that can compete with pain sensations that can come from massage, from massaging one's gums if we're in the dental arena, massaging one's muscles in one's jaw if we're talking about orofacial pain, and these competing pain sensations that are transmitted up the faster A fibers, which are the largest diameter fibers, the A beta fibers. These messages can cause the thalamus in the brain and then the cortex and the frontal cortex to interpret the sensations or perceive them as being less noxious and less intense because of the competing sensory stimulation that sort of blocks out the intense noxious stimulation. And in addition, there are other nerve fibers that actually send nerve messages downward, down the spinal column from the brain, and that activate peripheral nerves, which, as I mentioned earlier, can activate muscle fibers and turn muscle spasms on or off. And cognitive processes that are involved in the frontal cortex and that also integrate with lots of areas in the brain that are associated with memory and expectation and thinking and the processing of emotions. These A fibers can actually slow down the upward transmission of these noxious sensations and also send messages down the spinal cord that will compete with and actually block those noxious nerve sensations. Now, according to Melzack and Wall, Ronald Melzack and Patrick Wall, who developed what was called their pain gate control model, there are certain factors that open the pain gates in the spinal cord and the central nervous system, causing more pain to be registered in the thalamus of the brain, which is the sensory relay station in the brain. And there are also factors that are pain gate closers. The gate openers fall into three categories, and those are sensory factors, cognitive factors, and emotional factors. Things that open the pain gate, the flood of pain messages up to the brain, are things like immobility, injury, inactivity, long-term opioid use, poor body mechanics, and poor pacing of activities. Cognitive factors would include things such as focusing on the chronic pain, lack of interests or distractions, worrying about the pain, catastrophizing, and other negative thoughts. Emotional factors, which would include depression, anxiety, anger, stress, frustration, hopelessness, and helplessness, actually open the pain gate. These are negative emotional factors. Pain gate closers would include sensory factors such as involvement in enjoyable activities, the short-term use, smart, intelligent use of pain medications, relaxation training, meditation, and hypnosis. Cognitive factors would include things such as interests, thoughts associated with self-efficacy and distraction, and emotional factors, things such as positive attitude, overcoming depression, and assurance that the pain is not harmful, as well as feeling in control. Now, one of the things that is very relevant when we are talking about the design of clinical products and their marketing, so as to educate potential consumers about the benefits of using these products to alleviate pain, is to use appropriate languaging, and I call this comfort talk. So rather than say pain, we can say signal. Now, I advocate using the term pain sometimes because people come in wanting pain relief. But if you're always thinking pain, 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 that can up the pain. It's better to think in terms of signal, that pain is a signal from a part of the body that is registered by the brain, that something needs to be attended to. And sometimes there are signals that are coming inward or upward to the brain that can be ignored or put into the background because they're not providing any new useful information. Now, signal intensity is determined by the receiver, or should I say the perceiver, not necessarily, although sometimes partially, by the magnitude of the stimulus intensity, whether it be injury to tissues or tissue damage or impingement on the peripheral nerve receptors of destructive chemical, mechanical, or temperature sensations, such as intense heat or cold. The important thing to remember is that pain is a perception, and that it is an automatic and adaptive response to a sensation. Now, not everybody feels the same sensations as being painful. Some people like being tickled, and other people find it painful. Remember, a sensation is a sensory signal, and it's interpreted differently as a function of the person and the context. It's useful to often talk about discomfort versus pain, to say, well, is it painful or is it uncomfortable? There are a number of natural pain relievers out there that people who are educated about these products go to get some type of acute pain relief or acute pain relief on a recurrent basis if they have chronic pain. Things like menthol, camphor oil, eucalyptus oil, ginger, vitamin C, devil's claw, magnesium, turmeric, and there are others. As you can see from this PowerPoint slide, they work on the central nervous system, both in terms of the neurophysiological effects of these chemicals, but they also work based on the placebo effect and the expectations of the user as to their effectiveness. They work on different parts of the central nervous system. So, for example, menthol tends to numb the nerve endings, thus blocking or reducing pain signals. Camphor oil helps reduce swellings and inflammation. Eucalyptus oil actually is used to block pain signals from reaching brain cells. Ginger has been proven to have analgesic effects. Turmeric has been shown to have anti-inflammatory effects, and so on. There's a concept that I like to use, and it's called taming pain. And it is basically a better way of thinking about controlling pain as opposed to fighting it or trying to kill it, because nothing likes to be killed. And when you try to fight pain or kill it with quote unquote painkillers, the pain gets worse. Taming chronic pain, so, is not about getting rid of all pain. What it is about is lessening pain severity and impact. And it's not about fighting or killing the pain, it's about getting it under control using mindfulness. To be pain-free does not mean no pain. It means not being controlled by pain. When products are designed for pain relief that need to be marketed for educational purposes, when services have been developed for providing pain relief that need to be explained and marketed for educational services, it is important to be very clear on the terminology that one uses. And it is valid to talk about helping somebody to become pain-free, to help somebody attain freedom from pain. But it is important to make clear that pain-free does not mean no pain. Some pain is inevitable, but suffering is optional. Freedom from pain means to not be controlled by pain. Well, thank you for listening to this brief presentation. There are several free bonuses that you can get for yourself if you like. You can go to my website, www.tamingpain.com, and get a free advanced copy of the first chapter of my new book, Taming Chronic Pain. You can go to www.hypnosisce.com, which is our educational website, and you can sample for free my video course on taming chronic pain. You can also get a free 68-page PDF download on that site of the ebook, 30 Insights from 3+ decades of practicing client-centered hypnotherapy. Go to my main website, bruceeimer.com, and get a free self-hypnosis MP3 audio download, and feel free to contact me by email. Well, I thank you very much, and I hope that this presentation has been useful for you. Be comfortable.